Anas Sarwar.
Thank you, Presiding Officer. At the time the Queen Elizabeth University Hospital was opened, Nicola Sturgeon was the First Minister, John Swinney was the Deputy First Minister and Finance Secretary who signed the cheques, and Shona Robeson was the Health Secretary. We now know that the hospital was opened too early and when it was not ready, with devastating consequences, including avoidable infections and deaths. Political pressure was applied to open that hospital. Why did SNP ministers put politics before patient safety?
First Minister.
That was not the case, and the reference for that is what the counsel to the inquiry said on the 23rd of January, who said there is no evidence of external pressure on NHS Greater Glasgow and Clyde to open the hospital early or before it was ready to be opened.
Yeah, misleading again.
Anas Sarwar.
Presiding Officer, John Swinney is about to regret just saying that, because we know the culture of this SNP government is to avoid putting things in writing so that there is no paper trail. But all it takes is for the guard to slip once. I have here in my hand official Scottish Government meeting notes. These notes, written by a Scottish Government official, relate to a series of meetings held on the 16th of December 2019, the 19th of December 2019 and 10th January 2020. Those meetings involved a Scottish Government official appointed by the then Health Secretary, the Health Board's Director of Facilities and a consultant who had been engaged by NHS Greater Glasgow and Clyde to review what went wrong. It states in its findings in black and white, political pressure was also being felt and no consideration was given to delaying the opening of the hospital despite the issues being faced with completion and operation. Political pressure was also being felt. So will John Swinney now tell Parliament why political pressure was being applied to open a hospital that this note also makes clear wasn't ready and led to people dying? Or would he rather answer in the presence of his lawyer?
First Minister.
Well, Presiding Officer, there is an inquiry underway that is exploring all of these issues, which is taking evidence in the presence of Lord Brodie, a properly constituted public inquiry that is exploring all of these issues that are at stake. And the counsel to the inquiry said on the 23rd of January in the summary there is no evidence of external pressure on NHS Greater Glasgow and Clyde to open the hospital early or before it was ready to be opened. That's what the counsel to the inquiry has said, and Lord Brodie is obviously considering all of these issues.
Anas Sarwar.
He's been found out, Presiding Officer. This is a minute between a Scottish Government official appointed by the Health Secretary, the Health Board's Director of Facilities and a consultant appointed to look at what happened. And once again, this official Scottish Government minute of that meeting expressly states in black and white political pressure was being felt and no consideration was being given to delaying the opening of this hospital. That is damning. That decision to open the hospital early has resulted in a decade of lies, deceit and cover-up, bullying and gaslighting of staff, families being lied to and denied the truth, and infections that led to the deaths of children and possibly adults too, all because politics was put before patient safety. This evidence is damning. People died. So I asked John Swinney, was it worth it?
First Minister.
The issues that I've set on the record already is what the counsel to the inquiry has set out. And as Mr Sarwar knows from previous answers I've given, the Scottish Government was made aware of there being water contamination issues in the hospital was in 2018. The Scottish Government commissioned a public inquiry under the leadership of Lord Brodie, which enables all of these issues to be explored in full. And what that does is that enables the full consideration of all of these issues for the evidence to be assessed and considered and Lord Brodie to report. And that's exactly what he will do.
Question number 3, Alex Cole-Hamilton.
Thank you, Presiding Officer. Presiding Officer, last time I told the First Minister about former care worker Margaret McGill, who'd been in hospital for more than 400 nights. She's been unable to get home because the carers that she needs just aren't available. It has now cost the NHS nearly £200,000 to keep her in hospital when she doesn't need or want to be there. 3 weeks on, she is still in hospital in Wick. And Margaret's not alone. This week, we learned that the number of people waiting for a care assessment or for a care package has gone up by 20% in the last year. So can I ask the First Minister, does he really think that his draft budget will fix the crisis in social care and get people like Margaret home?
First Minister.
So the issues around social care are absolutely vital to ensure that we provide the care that people require. We're investing £2 billion in social care and integration, which has increased over the lifetime of the government. And obviously the government's budget includes substantial increases in resources available to local authorities and to health boards as part of the measures that are required to deliver effective social care support. Now, the issue that Mr Cole-Hamilton raised with me previously about Mrs McGill is it essentially rests upon the availability of personnel to deliver that care. And as I set out to Mr Cole-Hamilton the last time we had exchanges on this question, that issue is significantly affected by the availability of people of working age in areas such as Caithness to deliver such services. And we work closely with the local authority and NHS Highland to do all that we can to support the availability of care staff. And of course, the measures I've taken on access to workers from other countries will help in that respect.
Alex Cole-Hamilton.
Thank you, Presiding Officer. The First Minister knows that we are prepared to vote for his budget if the measures in it are right. We are here to get things done, and the Scottish Liberal Democrats have already secured some big wins through our negotiations on this budget already. Money to back young entrepreneurs, for colleges, for the Northern Isles, removing peak ferry fares, and for faster autism and ADHD assessments. But it is not yet enough to win our support, and we will squeeze every penny we can out of this budget process for business rates, for hospices, for the sake of people like Margaret McGill on social care. So can I ask the First Minister, is his government prepared to go further to win our support?
First Minister.
I'm aware that there are still discussions going on with the Liberal Democrats and with other parties about the budget process. The budget has not yet come to Parliament for Stage 1 consideration, but I would certainly welcome the support of other parties for the budget. It's always been a priority of mine to attract the support of other parties to the government's budget proposals. We successfully did that last year, and Mr Cole-Hamilton has given a long list of many reasons to vote for the Scottish Government's budget, and I confirm that those discussions are still underway.
Question number 4, Willie Coffey.
Thank you. To ask the First Minister how the Scottish Government's new National Housing Agency will support its work to deliver more affordable homes.
First Minister.
President, More Homes Scotland's mission is to bring simplicity, scale and speed to Scotland's housing emergency response. It will deliver for a generation of Scots new homes more quickly, more affordably, in more livable, climate-friendly communities. The 2026 draft budget includes the single largest funding allocation to affordable housing since records began in 1989. We have committed to invest up to £4.9 billion over the next 4 years, backed by a record £4.1 billion of public investment, helping to deliver 36,000 affordable homes and providing a place to live for around 24,000 children.